Assalamualaikum warahmatullahi taala wabarakatuh, and a very good evening to all of you. Welcome, and this is group discussion 2, Thursday, 5 November. Is it 5 November, right? Okay, 5 November, 2020. And I'm Amaziko Abi Hashim as the host and the chairman for this meeting. And I need all of you to introduce yourself. Start with Lisa.
Hello everyone, good afternoon. I'm Elisa E2049. So, everyone.
Okay, next. For anyone want to introduce?
My name is Dylan Lauki,
Yes.
and I'm a first year student in cell and molecular biology.
Nice to meet you. Okay, next.
Okay, hello, I'm Pavitran. Okay, basically I'm from Bachelor of Education, TESOL. Okay, that's all from me.
Next.
Hello everyone, my name is Diana Afrina and I'm a first year student in Science Biology.
Hi everyone, my name is Ardiana Natasha. I'm first year student in Bachelor Chemical Engineering with honor. That's all, thank you.
Hello everyone, my name is Nur Yasmin Suraya and I'm a first year student in Bachelor of Education in Sports Education with honor. Thank you.
Okay, so I forgot to tell you that I'm first year from the Bachelor of Accounting. So now every members, I think 8 members have present right now in this meeting. So let's not waste the time. So in the meeting agenda that been set up earlier, we have two main agendas, which are exchange news cadet for section 1, which is we set up for the last meeting that we want to do a health COVID response, and then for the second one, we select 2 news to be included in section 1 of our news publication and justify your selection why. So this is basically what we're going to do right now tonight. So you want me to share first? Can say this is I find about the COVID response in the section of the health. So let me tell you first. This is the title of the article is Malaysian's COVID-19 response: a good lesson for the West, says international report. That have been published by the Star on Wednesday, 17 June 2020, by Loh Fong Fung. Basically, this is the article about the Malaysian COVID-19 response. It's about the how Malaysian teach to the other countries about the management and response, about the management and the COVID response. So here is this. So I don't want to read all of the I think all of the sentences below. I think it's too much, so I will just summarize it. So what I get from this article first is Malaysians' success in contracting the spread of COVID challenges the idea that medical expertise and a robust health system is the best is the best channel by legacy powers and historically rich states. Actually, I don't know how to read this because it's my own right, so I don't know. Okay. Second, the report are from independent author, Dr. Fifa Rahman, which she from the United Executive Board member, and collaboration with non-profit organization, the Drug for Neglected Disease Initiative, the NDI. So this international reports was made by the Dr. Fifa Rahman, United Executive Board member, and also by the non-profit organization, the which is Drugs for Neglected Disease Initiative. So what the report said was the Malaysia showed innovative and speedy pandemic responses that keep infectious and death relatively low. Not now lah. I think for the past months, illustrated the value of a middle-income country's expertise in a global pandemic response. So, how Malaysia successfully contain the spread of the coronavirus? Not now, but from the past. Because now, right now, it's the COVID-19 cases surging right now. So, what the Malaysian government do are increase the number of the screening hospitals. Second, hospitalize all individuals diagnosed as COVID-19 positive, whether he or she symptomatic or asymptomatic. And then, third, planning and preparedness began as early December last year, including what the government do, is in terms of the government, coordination with the public health teams, plan for renovation of hospital for social capacity, and plans for procurement of the reagent. And then Malaysian also have experience in dealing with the past virus case such as SARS and MERS. So with the SARS and MERS experience, Malaysia also have able to contain the spread of the COVID-19. And then effort also were taken to optimize diagnostics capacity in both public and private laboratories, including the increase the capacity to diagnose the COVID-19 virus. You can check the fact and statistic here in the article. And then giving and giving or provide training to other government facilities and public health laboratories on how to detect COVID-19 spread. And then lastly, the report said that the Malaysian government upgraded the health facilities and diagnostics capacity in February. I think that's all that summarize the article, which the title is the Malaysia's COVID-19 response, a good lesson for the West, says international report. Can you, okay guys, can you hear what I'm saying right now? Can you understand?
Yes.
Yeah.
Okay.
Yes.
So this
Yes.
my this is my finding article. But for now, I will give for another members if they want to present. So who gonna to present?
So, as you can see, this article is from public health and research perspective. It talks about COVID-19 outbreak in Malaysia. So you can see that it's a very long article, but I'm gonna go through as quick as possible. So basically, this article talks about basically everything about COVID-19. From the abstract, it talks about how COVID-19 named like that and all that, and it also touched roughly rough explanation about what's this article are going to talk about. So in the introduction part, it talks about how it started originating from the Hunan, China, things like that. And but actually from this article, I want to emphasize only certain part, like this part, similarities and differences between SARS, MERS, and COVID-19. So this table show us a very detailed differences and similarities between these diseases, so that it gives the readers insight on how it differs from other disease that we've had before. And also at this section, it talks about how it transmits from one person to another, how it's originally started propagated by animal to human via direct contact. And starting at this part, this is the part that I emphasize so much from this article. Preventive measures. So it talks about how preventive measures that we can take, such as regular hand washing. They talk about things that we can do to avoid the spread of COVID-19. And in this section, it talks about COVID-19 in Malaysia, basically how it started, how it spread, a little bit explanation about how the cases rising, and explanation for each cases, how it's spreaded. Like this one, a 40-year-old female Malaysian was reported positive. This one is very detailed report on the COVID-19 cases in Malaysia and its data. So as you can see, it's a very detailed explanation and report about COVID-19 treatments. We got stages, asymptomatic and all that. And this part is preventive measures in Malaysia. This part is my favorite part, I would say, from this article, because it lists out all the preventive measures that we take in Malaysia. And this article also talks about MCO in Malaysia, how we started, how the government take action on this COVID-19 cases, and how we prevent it through MCO. Like people will probably hit it from attending mass gatherings and all that. And it also lists out some mental health care tips for like eat healthy food for us to maybe we can do and practice in order to take care of our mental health during this pandemic outbreak. And yeah, lastly, there's a conclusion as in, okay. And so that is what this article basically talks about. Yeah, that's all.
So this is the latest article, 8:38 p.m. I think it's just an hour ago. So the article says COVID-19 vaccine should be given free to every Malaysian, says MCA Youth. Okay, so maybe I think she's the one who said this thing. Okay, available, says the MCA. So actually the vaccine is already available. So maybe this is one of the way to bring the vaccine to Malaysia and provide it to our citizens for free, because probably the vaccine price is, it's stated there, 87 ringgit 60 cent for per dose. So I think it's a good suggestion, because if government provide this vaccine for free, maybe we can control the virus spreading in a short period. So Khairi had earlier said the finance minister had been told to set aside 3 billion to immunize 70% of the population against COVID-19. So this is a very short article, nothing to say much about this. So it's basically about the price and the availability of vaccine. So that's all from me. Thank you.
So to be short, this article is from malaysiahealthcare.org, and it's about Malaysia's medical sector. So the headline is Malaysia's medical sector welcomes patients worldwide in all weathers. So there's only a few things that I want to highlight, which is the Malaysia is positioning itself as a top-notch medical tourism destination in the Asian region, despite challenges as uncertainty looms large due to COVID-19 pandemic. Basically, that's all I want to highlight. And some few facts from this article is around 1.3 million foreigners seeking treatment in Malaysia this year compared to 1.2 million in 2018. So that's a quite huge leap for Malaysia. Yeah, that's all from me.
My topic is very brief that I will explain. So COVID-19 will probably become an endemic, which endemic means a disease or condition that regularly found among particular people or in certain areas. Like some countries will have this disease or certain ages like that. So some of the examples are like infections or disease like Ebola, influenza, malaria, or chickenpox, the common disease that everyone will have at least once in their life. It may take a few years, especially for countries that can't be able to control the virus spreading fastly. For example, like maybe US or France, maybe they will take a longer time for this so-called endemic to happen. When a sufficient number of people become immune to a disease, either through vaccination or natural infection, the spread of the virus will start to slow down and the number of cases will decrease. But the immunity, actually, we don't know how long it will last, even though if we have the vaccine. So maybe every year we have to take vaccination. Sometimes we have to take yearly vaccination so we can prevent for us to get this disease. So basically, this is what my article is about. Thank you.
Okay, so my article or my news is the title is with COVID-19 showing no signs of slowing down. What can Malaysia do? Proactive screening of workers' dorm. Title SOPs may help, say public health expert. I know it's quite a long title, but okay, let me summarize the content. Okay, the news or the article is about proactive screening of workers' dorm and tighter the SOPs to reduce the number of cases because due to no sign of slowing down in the COVID-19 cases, right? So the government or the article is ask us or suggest to do proactive screening of workers dorm and tighten the SOP. So this article more emphasize to proactive screening of workers dorm, proactive screening of foreign workers. So the workers, it means the foreign workers. The article is more to emphasize to foreign workers because they are the group that have high risk to get affected, especially those are working at red zone. And then we know also that the foreign workers such as Bangladesh and what so on, they stay in a dorm and hostel that overcrowded. So usually around 15 to 30 people in a unit. So we know that the risk of transmission is very high. And then according to the article, I don't know where is it, but I already summarize it. It states that MMA President Malaysian Medical Association, Prof. Dr. M. Subramaniam, said that proactive screening of foreign workers is important, but also the government must ensure that their living condition is improved. But however, to do this proactive test on workers' dorm, it could be costly to the government and the workers themselves. So I think that's all.
Oh, I'm sorry because my internet connection is unstable.
No,
So
it's
yeah.
okay. It's okay.
My news or my article is about why. Okay. So my article and or my news is about why 14 days quarantine is necessary for COVID-19. Make conclusion is because quarantine keep someone for a sufficiently long period during which he may develop symptoms or until he repeat test show infected. It is because infected person able to spread. So by the time he show the symptom, the spread to others have already occurred. So what I want to conclude here is the 14 days of quarantine is important. I already share my article in the WhatsApp.
I can hear you.
Sorry for my internet connection.
No, it's okay. It's okay. We can read it on WhatsApp. We can read it on WhatsApp.
So based on my findings, this is what I get lah. So it's very similar to the one that Pavitran news. So this is my findings. It's the title is at about 90 ringgit Malaysia each. COVID-19 vaccine will cost government at least 3 billion ringgit Malaysia. So this is published yesterday, 4th November. So from this news, it was stated that it will cost at least 3 billion ringgit Malaysia for the government to provide 70% populations of Malaysia. So this 70% of population is including the frontliners, which is the one that will receive the vaccine the earliest lah. And then the frontliners is including which working on health and securities. So it also stated that the vaccine will be supplies on the first quarters of next year, which is 2021 lah. So I think this is a good, a good news to provide in our articles. In our publication, because everyone is looking for the vaccines, because people is dying of this disease. So yeah, for my finding, this is all about it lah. If you wanted to see more or know more about this, I have shared the link in our WhatsApp group. So yeah, that is all.
Thank you very much. I think all members already presented their article. So let's just move on to the agenda 3, which there is which article that we should choose to be included in our publication. So as I go through to all of the articles that have presented by you, by all of you, I found out the articles is very interesting. I think it's a sort of the informative. I think just now some of our members focus on the symptoms, treatment, preventive measures, and then the others one focus on the cost of the COVID-19 vaccines. Yeah? And then others members also focus on the medical tourism. Yeah? So we need to choose 2 from 8 articles to be included in our publication. And let me justify why I choose this article, which is must be included in our publication. Is because for me, let's be frank, it's about the acknowledgement. Our reader need to know the Malaysian efforts on how to combat COVID-19. So that's why I think it's appropriate to include article, which is a Malaysia COVID-19 response, a good lesson for the West, for the West. And then what I'm going to say in the justification why I choose this article, because I realized that the Malaysia has done it so far in contain the COVID-19 spread. I mean, for the past month, not now, because the COVID-19 has surged right now. I think we should thank the government in terms of we release our publication regarding to the Malaysian effort to contain the spread of the COVID-19. How about all of you regarding these matters? I think every article is a good, much informative with the symptoms, treatment, preventive measure, and then Pavitran and Elisa, your article is related. I think is related. Focus on the cost and the COVID-19 vaccine should be given free to all Malaysian. And then Dylan, you focus on the medical sector. I think the medical tourism sector, I think is very good. because Malaysia have already toppled, not in the number one or number two in the medical tourism sector. I think we need to give a sort of acknowledgement to the publication. And then next about the how COVID-19 will probably become the endemic. I think it's very good. You predict the future on how the COVID will slowly from the pandemic to the endemic. Another one, another member present on why 40 days quarantine is necessary for COVID-19. I said it's very good. Like I said, it's very juicy information on why 14 days is very stable days as we want to quarantine. And then I think all of the articles is very good, but for me, I will choose my article, and then Pavitran and Alisa article. Just you combine the article because it's just tell the same things. Okay, what about your opinion?
It's actually the same thing.
Yeah, yes.
So better choose either one, because I think Elisa Martin, I think it's better to go for her. I think it's better to choose her article because it's quite long and more informative compared to mine, because mine is very short and not so informative, and it's really very short. So better go for Elisa Martin's article.
I totally agree with Ama and Pavitran, and I would also like to suggest article from Artika. We need everyone to know about the symptom and how it differs for everyone. And then the most important part is also the preventive measure. Like personally, I feel like we need to keep on stressing about the preventive measure so that it will be embedded in people's mind. That's all from me.
Okay, very good reason.
I want to share my opinion. So I think all of articles that presented by us also all are very interesting and very informative. And but I personally think Yasmin article talks about why 14 days of quarantine is necessary, right?
Yes.
So I think that is important too, because people need to know why is it 14 days. And I also like to justify my own article. I think it's a suitable article too, since the article includes from A until Z, all about COVID, how it started, how it spread, and it also emphasizes about preventive measures, the symptoms for in individual to experience in order to diagnose with COVID-19. But you also can, like, maybe if the article is too long, maybe we can take parts of the article to be inserted in our publication. Yeah, and I also think Elisa article also is very good.
Yeah.
It talks about the vaccine, right?
Yeah.
Yeah. I think, yeah, that is my opinion.
For my opinion, I think Elisa article about vaccine is very good. And then I also want to justify the reason I choose my article. The reason is because I think the article that I choose is very important and useful to readers know how foreign workers affect the rising number of cases, because the foreign workers, they stay together with a lot of members, and then it will cause the transmission among themselves is very high. The risk transmission among themselves is very high. So I think it's very important to the readers know how the foreign workers can lead to the rising number of cases, because we can see the information day by day about the number of deaths. Basically, it more to foreign people more than Malaysian, the deaths of numbers. So that's all for my opinion.
I think all articles are very good, much important, but we need to select two of them, two from 8 articles. For me, I think Alilisa article should be included in our publication. So let's reach the decision. Let's reach the decision right now. So who agree to include Alilisa article into our publication? Raise your hand. 1, 2, 3, 4, 5, 6, 7. Okay, I think the majority agrees. So Alilisa article will be included in our publication. Okay, so we need to find another article to be included in our publication. Since Alilisa article is about the latest issues like the COVID-19, I think that another article should be like the fact, like the Airy article, like the Adiana article. So let's talk about it.
So, in my opinion, I think Adriana's news is good enough to be included in our publication because it seems to be it was related to what's going on nowadays in our country because the number is rising, the number of cases is rising, and as we know, in the middle of I think past 2 months, the number keep rising. It is because of the foreign worker that came into Malaysia without our permissions, right? So I think this is a good uh, good news to be included in our publications so that people pay attention about this. And it is true that we need to be proactive in this thing. That screening need to be done in themselves lah gitu.
I think that's a good point. I kind of agree with all of you regarding Diana article. About the others' opinion, anyone want to share? Diana, do you have any opinion?
Well, since I think most of you already agree that Adriana's article is the best to choose, so I think I agree too.
Okay, so let's reach the decision right now. So if the members agree to include Diana article into our publication, you can raise your hand right now. 1, 2, 3, 4, 5, 6. So the majority agree to include an article into our publication. Enough. I think that is enough. First Elisa, First Elisa, and second Adiana. Okay, so I think it's done for our third agenda.
Let's discuss about, okay, since we based on what I asked from Miss that day, we need to kind of edit our publication.
Yes.
Right. Okay. So how are we going to do that? Because ni I cakap je lah, I can volunteer myself to edit our publication. You know. So I mean, if you guys okay with it, but we do the summarizing and rewording of the articles from both articles we chose just now. We do it together. Just in terms of editing the layout of our publication, I can volunteer myself to do it if you guys are okay with it.
Okay. That's okay. I mean, I'm okay with it.
I think I have no problem.
How about the one?
Design?
How about the one that edit the layout? Don't need to summarize the content. Like other people summarize the content and give the content to the one designing the layout, then he or she only design the layout.
Yeah,
Yeah,
I think that
that's good.
maybe because for this section, me and Adriana is the one. The article is from me and Adriana, right?
Yeah, yeah.
So I think we can summarize our own article first, then we give it to Eri lah.
So
Hmm.
for section 1, is it Elisa and Adriana we're going to summarize the article because it's your article, right? Okay.
I'm okay with summarizing my article.
So Adriana, are you okay?
Like we do our part je lah kan?
Yeah, yeah. Because
Okay,
this is
boleh.
your article, so I think you have a better understanding on the article. So I suggest that you will just summarize the article. Okay.
Alright.
So Elisa and Adriana will be summarize the article from section 1. Okay. So maybe section 2, 3, or 4, maybe someone else will be summarized. Okay. So I think it's already 10:10. That's all for today. Don't forget to find any articles or any information regarding scholarship so we can present it on the group session 3. So that's all. Thank you for all the members who joined this meeting and have a good day. Thank you.